Okay, so good morning and good afternoon to everybody, wherever you may be in the world today. And for those that watch this afterwards, we welcome you. On behalf of Dr. Joseph Ahrens, I would like to give you the warmest of welcomes, and we truly do appreciate you coming on each week. And we also really appreciate you sharing the knowledge of what is provided to you in here. So thank you so much. And again, he puts his apologies in and he will return at the earliest convenience. And I have given him everyone's warm wishes and your thoughts. So thank you so much. He's appreciated it. But today's topic, we are going to just talk about Emulin and why everybody needs it, the various doses and why, and how to approach sporting organisations and businesses and individuals, like how do we do that? So, but first I'm going to just jump into a PowerPoint presentation first, and just to remind people just exactly what we do have, so we can venture through that and have a look at it. And we'll put that there. And hopefully I will get this right. So for us, I mean, some of us have been with Emulin for quite a few years, and it truly is the missing link in health, you know, providing missing flavonoids that we just cannot get out of our food. And there's a few reasons sitting in there that not only is it in the food, but it's in the soil. That's the other thing as well. So, and this product has had, you know, 15 years of research minimum to be able to bring it to this place as to where it's at now, prior to it coming to the previous company and now to Valentis. And Dr. Joseph Ahrens is the scientist behind this, the chief scientific advisor behind it. Just a wealth of knowledge, a phenomenal wealth of knowledge, and just an incredible man in regards to having a passion for wanting to provide knowledge in health. You know, whilst it is, we understand it is about products and we want to know about, you know, what we can do with these products, he really wants people to understand the benefits of looking after yourself in health. And it comes with a lot of credentials, being a dual nominated Nobel Prize scientist. And one of those was for the work that he did with Emulin, and the other was for the work that he did with Ebola in Africa, which he has a huge passion for. So if we start looking at Emulin, you know, what is it? Why is it essential for everyone? What is it made from? And what is the link between, you know, today's nutrition and Emulin? And I want you to think about this as you're watching this, you know, so let's look at things and think about yourself and how you feel right now. And let's consider what a difference your lifestyle choices can make to your life, you know, what your food choices are. And Emulin needs to take time. And I really want to make you really think about this and remember this, that it needs time. So, you know, most people will start at 3 months, and they start because they do not feel well, like the symptoms that they're combating are generally making them feel unwell, not being able to manage with everyday general life's duties. You know, once they commence on this product, within 3 months, they're going to notice a bit of difference. By the time the 6-month period comes, they're going to start and feel a lot better. 9 months, they're certainly putting a bit of a glow on their cheeks. And 12 months, well, I mean, you're jumping up and down for joy. And, you know, and give it 12 months. But you are going to notice a difference as we go through this slide, and I'll explain why. But give it time to unravel at a cellular level. So when we start looking at, you know, that people will feel a difference within weeks and feel fantastic, and you will be amazed within 30 days or less. But, you know, mental clarity, seeing life with a clear focus, minus any fog, you know, what do you see in your future? One of the first steps forward, like this is one of the first steps that you really start to notice, that we have noted with a lot of other people on this product, is that mental clarity and being able to have clear focus is something that comes to the forefront pretty much instantly for a lot of people. But let's talk about carbohydrates and sugars and where they fit into this equation on where we're looking at what the problem is and why do our bodies develop inflammation. And the problem basically being, it's quite simple. Carbohydrates metabolize into simple sugars and they raise your blood sugar levels, causing inflammation. And we're just looking at a simple little bowl of rice here that would be equivalent to when you go into a Chinese restaurant, Asian restaurant, and it's a small little bowl of rice. And that's how many lots of sugar, cubes of sugar that you're looking at. It's quite alarming. So when we start looking at the Asian countries, one of the highest problems that they have is diabetes. So you can understand why, because there's a lot of rice. It's one of the traditional sources of food, but it's also a cheap source of food too, to feed a lot of people. But rice has no nutritional benefit except when used as an energy source. So if they're not using it in energy, it's going to be dumped and it's going to be turned into just sat there as sugar and fat. So refined sugar is a toxin, an addictive drug, a poison. So it's never meant to be stored in our body. It's something that should be used as fuel. But unfortunately, you know, lives change, things change for people. And if we're not using it as fuel, then obviously it's going to be dumped into the body and we're going to find we're going to be adding to our inflammatory levels. So even just looking at the added sugar consumption, so heading back from, you know, right back into the 1700s, the average person would consume 2 pounds per year. This is conservative, and this is just 2000. Imagine what it's like into 2020. I think we're probably up in around the 150 pound or even 160 pound per year that the average person would be consuming in sugar. So sugar really is, you know, in nature, sugar is either a poison or an energy source. So you can look at it. It's something that we need, but it is one or the other, and it has a deadly cycle. So, you know, you'll eat sugar and you like it, you crave it, it's addictive. It raises your blood sugar levels, the dopamine levels in your brain, so you feel good. You know, like chocolate, it's noted, it makes you feel great. But as much as it rises the dopamine levels into the brain, and it gives you that massive sort of increase in feeling great and energy, it drops just as quickly. It's an empty food that you're consuming, and eventually you're coming back to where you started. You're hungry and you're craving food again because those levels just drop, and it's a cycle that just continues to repeat. So carbohydrates are individual units of sugar. So excess carbs lead to carb toxicity, increased blood sugar levels, elevated blood fats, excessive weight gain, poor sleep, sluggish physical and mental energy, tiredness, hunger, and prolonged excess carb is the root cause of most diseases. So because there's a reason behind that. You know, when we start looking at this, please note that refined carbohydrates and sugars fuel inflammation. I think this is a really powerful slide because it doesn't get much simpler than to explain. You know, add some sugar and guess what's going to happen to those other matches? It's just going to fuel the levels of inflammation within the body. So Emulin regulates the immune system to support inflammatory levels throughout the body. Support, I will say. And if we start looking at this little body here, he looks like a pretty unhappy little camper. So I really want you to have a look at this person and think to yourself, whilst they are conditions, we really are looking at targeting symptoms. So maybe there's a person that you know that has these types of conditions, and maybe it might be yourself, that we're able to assist in supporting the symptoms with Emulin. So Emulin, you know, inflammation is present in all of these conditions that you've just seen in that slide above. And I want you to really think about that one too, because you will notice that, you know, it's just like the roots of a tree, that in the roots, we've got nutrition that we're relying upon, that we're fueling our body with. And then the deficiencies show on the outside of our body, just like the leaves of a tree. Like if you've got an unhealthy tree, it's like our bodies. It starts to show on the outside, which through our skin, through things that start to occur for us, this happens for our body also. So inflammation is the first step of the immune response to infection, irritation, or injury. But inflammation is useful for the body. So if you've got a short-term problem, we really need inflammation because the troops will be sent to that area to help the body to repair it. And it's something that the body needs. We need that. But it's the long-term chronic inflammation that can cause other problems and other conditions that we really do not want to have. So this is where being able to manage inflammation is really important to be able to do that. So excessive consumptions of refined carbohydrates can lead to inflammation. So the missing link to nutrition. I like to think it's Emulin personally. So in short, however, nearly 85 to 95% of health disorders have inflammation present. So you can imagine, when we start looking at why this product differs to all other products, is because it has the ability to be able to address the inflammatory levels that are the main base root cause of these conditions that we're looking at. And there is no other product on the market like this product. So natural changes do occur. Foods simply lack nutrients needed, which then created a flavonoid deficiency syndrome, which meant basically that there is the lack of the goodness in the foods that we're getting in our diet, which results in a dysfunctional carbohydrate metabolism and chronic inflammation, which then turns into disease. So Emulin puts back what has been taken out of our original diets. Flavonoids are found in fruit and vegetables. Emulin replaces the flavonoids which are missing from our food and diet. And flavonoid deficiency results in low energy and eating more carbohydrates, which make it worse. And let's be honest, like for most of you that are looking at, if you eat and you head out somewhere and you have a lot of carbohydrates, you have what we call a food coma. I've got to go home and have a rest because you just can't move. There's a reason for that. So we are not curing or treating any diseases here. So I want you to really just remember that when you're talking about it. So who, what, and how? What's the missing link of nutrition? Emulin. And there are three components of this product. So when we look at it, one of them is chlorogenic acid, which comes from green coffee beans. And I want you to think about this, that these are extracts of. So even if it's a very small percentage of people that may find that they cannot take these products because of, but it's a very small percentage, because what you're looking at here is an extract. It's not the whole coffee bean as such. But when you look to the right, you can see all the benefits that this particular component provides to the body. And we look into the second component, Muriciden, which comes from grape pomace. Again, you're looking at incredible things that this product supports the body in being able to assist in the symptoms that we're dealing with. And the third one is quercetin, the onion bulb. And again, looking at reducing these types of things within the body with the conditions that we are dealing with. So the synergy of these three active ingredients are what we know as the essential vitamin called Emulin. And if I look at this just briefly, just touching base on this, just to give you a little bit of a visual on it, is that when we're looking at the grey line here, which is rice, that we look at rice and we think, well, look how much when we started, how much your blood sugar levels rise, because it is loaded with sugar, as opposed to the green spinach down the bottom and even an apple. It's still going to raise your sugar levels, but not to the extreme of what we're looking at with rice. So it does depend on what you fuel your body as to what's going to occur in your inflammatory levels. So, constant intake of excess refined carbohydrates lead to chronic inflammation, not acute, but chronic. So how does Emulin work? It manages 7 critical control points. So Emulin upregulates or downregulates 7 key enzymes, which is a really important word at the moment, in your body to control how you use sugar. So the body wants to maintain status quo, what we call homeostasis. I'm sorry, I just got to let a couple of people in. It's like trying to control traffic in a big city with one cop. It's literally impossible. So if you just control one of those control points, the body just will not respond as well. But if we can manage to control 7, which Emulin has the ability to be able to support you in, it starts to become a whole different scenario for us. So what can Emulin do, and how can it assist and support my body's health? I know that you're asking that. As we said, there are 7 key points in the body which interact with carbohydrates, and we need to modify the effect of the carbohydrate in the body or on the body. So Emulin helps with energy and better sleep, and it can assist in joint pain, reducing your cravings for sweet and carbohydrate foods. But it also provides a daily dose of flavonoids to reset the metabolism. There's some key things here to take away from it. So within a week, we will see an improvement in our health, and everybody differs here, I will say that. We need to reduce our intake of carbohydrates and increase proteins and fats. And it is possible to actually have a meal or a day each week without eating carbohydrates, I tell you, your body will actually thank you for it. But when we eat sugar, the part of the brain which lights up is the same part which lights up when people use cocaine. That's how much of an impact that sugar has to the body. But when we look at real food, and I mean real food has color and taste and can be eaten raw. We cannot eat wheat and rice raw because our bodies do not have the enzymes to digest them. Rice has no benefit to the body. And how to tell if something is a good carbohydrate, is to ask if it can be eaten raw. So when you start looking at your food, what does raw really mean and how good it is for your body? This is a really good key point to take note of. We need to eat fruit, eggs, and nuts, and we cannot live without protein, fats, but we can live without carbohydrates because 1 in 5 people are carbohydrate sensitive. But we need to understand how to balance the body, and everybody is quite different here. So manage sugars, support your immune system, restore it to normal, which will assist in regulating inflammation and properly manage the sugar in your diet as nature intended, and you're going to notice a huge difference. So who should take Emulin? Just like a vitamin, everybody should take it from womb to tomb, as we have often heard. It does not matter who you are, everybody should be taking it. And this is just a nice picture because even your dog can take Emulin. Horses have been taking it. Monkeys have been taking it. Cats take it. Anything that breathes can literally take Emulin. So I hear you asking, which one do I need? Because firstly, let me say to you, everybody needs Emulin. It provides our bodies with essential nutrients that food is simply missing. And we do have 2 formulas and 2 forms of Emulin. They both manage sugar metabolism and they both manage inflammation. But Emulin C is focused on controlling sugar. Emulin M is focused on managing inflammation. But I will say that they both manage inflammation. I'm just pointing out the difference between the two as to what they significantly do differently. So I have put the little seal on here as promised. I've grabbed this off of my website that's just been done. So we do now have the BSCG and our label, and I'll go into that as to what that means. And it is just for Emulin M at this point in time. So Emulin M, as we said, is for, it is a carbohydrate manager, and it is the world's first carbohydrate manager. That's very important to understand, and it does have a published paper on it for diabetes too, Emulin. So families of all ages are safe to use a natural plant-based vitamin called Emulin. Pregnant mothers through to, as we've already discussed, basically everybody can take this product. But everybody is different, so no 2 people are the same. Not one of us are, not even in our family members, none of us are the same. So this is where the dose may need adjusting. So Emulin is a vitamin, so it is safe to adjust your daily intake as needed. And please make sure that you do, because if you're navigating with a medical condition that is challenging you, please consider adjusting your normal daily dose, as it can assist and support you in reducing your inflammation and your symptoms, because we all change all the time. Our bodies change. Detoxing can be different from one person to the other. Just as your body changes, your symptoms may too. You may get a cold like I have at the moment, so I've increased my Emulin. Rehydrate with water. Fuel your body with quality choices to support your body as your body rebalances itself with the support of Emulin. Now, the science and the technology, as I said previously, has over 15 years of research, and Emulin has clinical studies and patents attached to it also. So this is one of those, and you can search for this. A PubMed extract on the effects of Emulin on blood glucose in type 2 diabetics. It's something that you can go and research, and you're able to use and share. The Emulin has had human clinical studies on 40 patients, which is a type 2 diabetic, half on metformin and half on no control. Half of them received a placebo and half received Emulin. And this is where they were able to provide you with the published paper. And if we look at our competitors with Emulin, those 7 key elements that I was saying to you that Emulin addresses are across the top here. And if we look at our competitors down the side, there is not one of them that has the ability to be able to address those 7 key points and the 7 key metabolic pathways that Emulin is able to support as opposed to the competitors that are out there in the field. I think that was actually my other products. Allow your body to find balance and unwind the feelings of dis-ease, not disease, but dis-ease in how your body is feeling uncomfortable with the time that it needs. It takes time to assist the body to unravel at a cellular level, and you need to be able to support that with Emulin. And think about how long. I want you to really think about this, because you'll start somebody on this product and people will say to you, I didn't get any I didn't feel any difference. Well, how long have you been on it for? I've been taking it for a month or 2 months. But how long have you been challenged with what you're dealing with? Like, what you're dealing with, has that been 12 months, 6 months, 2 years? Oh, it could have been 5 years. It might have been 12 months. It could have been 10 years. Allow the body to unravel, find a new balance, and it's going to take time. So just have the patience and just let people know that. These are just a few quick test, like as you can see, visual responses from Emulin. So this one actually is just quite amazing, to be honest, because it was a 3rd-degree burn for this woman on her face, and within a week, I know this person personally, and this is exactly as it is. She should have had a skin graft, to be quite honest, but it wasn't necessary because of the assistance of Emulin. I know this lady too. This was actually the previous one's sister, if you can believe it. And this was after 1 week of taking Emulin. And this was another one with psoriasis. Again, the body healing itself with the support of Emulin. When we talk about acute inflammation and we talk about chronic inflammation, this is where we're looking at acute inflammation, where the body will go in and help it heal itself. So let's look at what's just happened for Emulin, and I think it's very exciting. We spoke about it last week, and I want to touch base on it again today. The BSCG, it's the Banned Substance Control Group, and you can look this up for yourself. It's a certified drug-free company that certifies the product that it has the quality, it's gone through the process to be able to say that globally, like my husband who played professional sport, we're now really excited because this takes it into that field, but it also takes it into kids in sport too. So this is what you're going to be looking at when you go to the website, the Banned Substance Controlled Group, and you'll be able to search for yourself, and you'll be able to see that when you go into this pathway of searching for it, you'll be able to see that Valentis is actually there, and you're going to be able to share this with people and show them that it has actually been certified, and it is free of over 496 illicit substances. What does that mean? It means they have put 496 plus drugs into this product, and they tested it to be able to withdraw all of those products out of Emulin so that it could show that it's not a product that is a screening agent, where it's able to you can take it and it can actually provide a screen where you can take something and it's able to act as a masking agent or a masking product. This does not do that. And this is why it's gone through that process. And this is what makes it so very powerful going forward, because when you look on this website, you'll see all of the associations globally that this certification provides going into sports of all ages. So this is kids that go to sport as well, like that play sport at school, because they're the ones that all of a sudden that get they get picked up by a sports scout, and all of a sudden they find themselves that they're actually in the big league. They're playing in junior elite sports and so forth. So, but it's not just there. I want you to think about this too with Emulin, is that the ability to be able to utilize this and promote it to people that are in the workplace that get drug tested, because you can imagine that even being drug tested in the workplace is generally by the same organizations as well. So it does create another space to be able to promote it to as well. But we do need to make sure that we're compliant. And I know that we talk about this often, but we cannot talk about conditions. We cannot say that Emulin has fixed, healed, or cured arthritis, or fixed or cured my back. but it has managed to assist and support the symptoms that I was dealing with. It's really important to know that. Why am I so passionate about this? Because this was me in a hospital bed. This was the amount of medications plus that I was on. And this is me today. I am one happy camper that I still have all of these conditions that are down the right-hand side here, and I'm still dealing with them and still having, surgery every 3 months for something that I need to manage. But I'm a lot happier person, and there's only one thing that has changed for me, and my doctors have recognized it, and that is Emulin, because it's addressing the symptoms of the inflammation in my body. And by addressing the symptoms of the inflammation in my body, the neurological symptoms and the pain symptoms that I was experiencing have been able to be supported and assisted. So therefore, my body's a lot happier. And there's just one reason for that. So invest time in your health before your health invests all of your time. And I really do want to thank each and every one of you for joining us today for that presentation. And I just really want to now just open it up, because I know it was probably a little bit of a lengthy presentation, to ask Ron, have you got anything that you would like to add? And if anybody's got any questions.
Okay, Jackie, can you hear me?
I can, Dawn.
Hi, my daughter is pregnant and she's 6 months pregnant. How many Emulin do you think she should be taking? And she is borderline gestational diabetes. So should she be on a C?
Dr. Borsema, would you like to answer that?
Borderline diabetes, I would say C might be the better choice. And, I guess it goes by weight. And, I would start slowly and work your way up and see what happens. That's always the best way. I think people need to really start to read their body, and we're not taught to do that. We're just told to take a medication, and if the symptom goes away, stay on it for the rest of your life or whatever. That's not what Emulin is a food, and it's in a very bioavailable form. So that's the cool thing. The first thing I noticed when we were talking, and every time we hear Jackie, Dr. Joe, anybody who's knowledgeable about Emulin, is there 4 or 3 food ingredients. Those are whole foods in terms of their extracts from a whole food. I should say it more clearly, but they're food that the body knows what to do with. And it's just allowing each individual body respond as to the condition it's in. Some people have good, strong immune systems. Some have very poor. Some people are eating a really good diet. Most not so much. So it's really, use your own intuition, check with the medical doctors, if there's conditions that are going on like that, always just show them what you're taking and go from there.
Okay, I appreciate it. Thank you.
Great. Has anybody else got a question that they'd like to ask? Because otherwise, what I will say to you, I'm going to address what is behind me here, how to approach sports organizations and businesses and individuals. The best way to do this is that banned substance control site that I showed you, that seal. Go to bscg.org, I believe it is. It's in the presentation. Go to that. And it's your responsibility to, when you're explaining to somebody that, and this can be into a physiotherapist, into a massage therapist, a doctor, anybody in the medical space now that is dealing with looking after athletes of any age, that if we're looking at really targeting that space, that you need to actually provide that to them. They'll do their own research, and you can show them if you want to. You can print it off and show them, but it's good for them to go and do their own research. If it's an individual athlete, it is their responsibility, not yours. And please don't take on that responsibility to say, I assure you. Please do not use those words. Please ask them to go to bscg.org and do your homework, because you will see when you go there that it is certified. Make them do their own homework, because if something happens, you do not want to be responsible for you telling them that I assure you that this product is okay. I want to share with you what we have. We've got this amazing product, Emulin M. that has been certified with the banned substance control group. What does that mean? It's been, tested with over 496 illicit substances, and it has been shown to be a product that they have put their seal on to be safe for people to take. But I want you to go and have a look at that website and check for yourself. That's what I suggest to you to tell to people. And do not take any other approach. I've spoken at length to my husband, David, about this, because we're approaching people in the sporting industry and saying to them, and said, how do we approach them? What do we do? He said, it's not my responsibility, Jack. He said, all I can do is give them that website and tell them to go and have a look. If they're interested, come back to me, then we'll have a different conversation. Has anybody got any questions on that? No? Okay.
I think that's just overall good advice in general, Jackie, to have people, and we're not trained to do that. We're told, listen to your doctor. He'll make all your decisions for you. Don't do any research because it might scare you if you do. Don't look at the label that's in the package you're getting from your medical doctor. It'll scare you and you might not do it. Everybody needs to do this. And I know Dr. Joe is so on board with, we need to take a look at what we're eating, number one, because if we're taking Emulin to overcome a poor diet, that's not the answer. We need to do our research into what foods we should be eating and then use Emulin to support that, to support the body back to health. And boy, we couldn't have a better product. And now with what else is coming down the pipe from Valentis, oh my goodness, I think we're sitting at the right place at the right time with the right people. And I had an opportunity, I'll share at a later time, something that happened today, an accident that turned out to be a blessing.
Yeah, no, you're so right there too, Ron. And I want to say, when you're looking at sports people, recovery is a really big, important factor for them. Like, they want to recover. So even if you've got a child that's played sport and they may have, hit their shin and they've got a hematoma or they've got a bruise, something that's created soreness there for them. You want to have the best assistance that you can for the inflammatory levels to be lessened and supported as quickly as possible. And this is where acute inflammation is addressed with Emulin. It has the ability to do that. And so going through to, the next tier of like teenagers playing sport for fun, but then you get the guys that are, stepping just below heading into pro sport, that you're looking at the first thing that they want to do is get their recovery. It is the very first thing that happens with sport. They start taking those steps to provide all the assistance that they possibly can, that their body is going to recover as fast as they can to be able to get back on the paddock and be able to train again, and then to be able to play again. And even for us as a general person that I want to go for a walk every day, well, if my symptoms are limiting me from being able to go for my walk every day, I consider myself to have a Ferrari of a body because I want to feed it and fuel it like that. Not because what it looks like, what it is as a body. I respect my body, but I want to be able to walk every day. So that's my athletic outlook for the day. And I think if I can't do that, this is where Emulin can assist me by managing my inflammatory levels. So it gives me the ability to stay mobile and to be able to not have those symptoms and to be challenged by things that limit you from doing things. And this can be even into even putting your arms up to the top of the cupboard to lift something from the cupboard. It's something simple. As people age and they get into their 80s, 90s, if they're lucky enough to get to those decades, it's still important for them to get mobility. And it's been quite amazing. My parents are 80 and 84, and I look at them as to what a difference that it has made for them, even though that they have a lot of challenges. It's made a big difference for them. And so I think that's the important thing when we look at how do we approach sporting organizations, but also look at the workplace. Because here in Australia, and I think it may be the same globally in other countries as well, we have what we call FIFA, so fly in, fly out jobs, that people are employed on the mines that are offshore in the ocean, or they're inland remotely. So they'll go for 3 weeks and they're home for a week. So 3 weeks at work, home for a week at work. But they get drug tested. You know, my sons work in an environment, both of them, that they get drug tested on a regular basis. So I now know that they can take Emulin M because it has that BSCG seal, that it's going to be safe even for that environment. So it gives you a bigger range to be able to share. But again, you would give them that site to go and have a look at and let them do their homework and ask them to come back once they've done that. And, you know, it will speak for itself, and they should be literally running back to you when they understand what it can do. So hopefully that's given you a really good, you know, gymnasiums is another area to take this into. It's just I wish we had it when we had, you know, when we had our gym, when we owned it, because guess what? We'd be sitting all over the shelves in our gymnasium, Emulin. And I wish we did have it for a multitude of reasons, but a gymnasium, personal trainers, those people, you know, start and approach them, give them the website, let them check it out. It's not just another product, it's a phenomenal essential vitamin that everybody needs to get them back to where they need to be. So hopefully that's given you a bit of an overview. Don, have you got Ron, have you got anything that you'd like to finish up on?
I think you nailed it. The presentation speaks for itself so boldly and plainly, and I think people just need to put it in here, put it into action, and then take it internally because it works wonders in the body.
Yeah. Thank you so much for your support, Ron. I really appreciate it, and I appreciate each and every one of you. And I'm going to thank you so much for today's call. Please stay on afterwards. I've got a question I'd like to ask of you all, but on behalf of Dr. Joseph Ahrens and myself, we really do thank you, each and every one of you, for turning up each week. And for those of you that share this call and for those that watch it afterwards, we really appreciate it. And any questions that you ever have, just email them into info@drjosephahrens.com. And please allow us time to get back to you, especially at the moment. So thank you so much, and we'll speak to you next week. Thank you.